You you put your information in the chat with your name and where you're from. So we would like to begin acknowledging all registrants at this time.
Greetings, everyone. We've asked that we'd like to do roll call. So if you could put your name, what city you're calling from, if you have an organization affiliation, and what church. We'd like to see who's on the call. So there you go. Someone from Knoxville. We have Memphis. We have Nashville. Anyone else? We have Memphis, Brownsville. Pastor Causey, I see you there. Dr. Coleman is calling from Jackson.
We have Dr. Marble and Dr. McNair. Pastor Fisher. From Perkins.
Miss Scott of the Double Ks.
So Kelly. Holloway. Brownsville.
We have Chattanooga.
Dr. Coleman has joined us. From Humboldt.
Hi there, Danielle from TJC.
Got somebody from Ottawa.
You have someone from Oakville, Tennessee.
Matt Francis Williams from Seminary. Hey, Miss Williams.
Keep it coming, Reverend Williams from Jackson. Hello, Miss Williams. How are you? Francis. All right, that's great. We have hello, Sandra White. So please continue to put your name and information in the chat as we proceed to the next step.
Dr. J. Lawrence Turner has devoted his life to meaningful ministry, which has made immeasurable impacts across the nation for 25 years. For the past 10 years, he has faithfully served as the senior pastor of Mississippi Boulevard Christian Church, the Disciples of Christ, in Memphis, Tennessee, the largest congregation in the Disciples of Christ denomination. He's a native Nashvilleian and graduated magna cum laude from Fisk University with a bachelor's in religion and philosophy. He received his master's of divinity from Yale Divinity School and was awarded the prestigious H.H. Tweedy Prize for Exceptional Promise for Pastoral Leadership. Dr. Turner earned his Doctor of Ministry degree in Transformative Leadership at the Colgate Rochester Crozer School of Divinity in Rochester, New York. Dr. Turner has served as the bibliographer for the Congress of National Black Churches annual national consultation and is a member of the advisory team for the Issachar Church Growth and Development Conference. He's a 2021 inductee in the Dr. Martin Luther King Jr. Board of Preachers at the Morehouse College. Bridging his passion for faith and social justice, Dr. Turner found and serves as the president of the Black Clergy Collaborative of Memphis. He's a father, a pastor, a preacher's preacher, and a prolific teacher. He's an advocate for social justice. I present to you none other than the Dr. J. Lawrence Turner.
Vivian King, thank you so much for that introduction. It's an amazing introduction. I'm not even a featured speaker tonight, but I'm grateful to have the opportunity to serve alongside each and every one of you who've joined us on this evening. I would be remiss if I did not shout out our phenomenal and illustrious executive director, Dr. Shirley Bondon, who has done such an effective job with leading ACT, African American Clergy Collective of Tennessee, and grateful to see a number of the pastors who are part of ACT on this evening, and we're hoping that more of you will join us in the cause that Christ has given to us. So listen, we know this is the evening, so I hope you will stay engaged and energized. I want to just begin by sharing just a little bit about ACT and the work that ACT is doing in this state. We are an ecumenical alliance of African American churches that's been brought together in order to build collective power, which centers the needs and the hopes of marginalized Black Tennesseans in order to create conditions for those once silenced voices to assess policies and social institutions in terms of their impact on the poor. There are many issues we know that we face in this country and in the state of Tennessee. However, ACT focuses its energy on 4 specific areas. We focus our energy on healthcare, on criminal justice reform, on education, and civic engagement. You can see on the slide that as it relates to healthcare, we recognize that healthcare is a human right. And so we're working towards and advocating for legislation to be advanced to fund the availability of health care for all people. When it comes to criminal justice reform, we're focused on ending harsh political and racial inequities at every point in the criminal justice process. We proclaim a gospel that challenges us to call for reform of the criminal justice process that will be more redemptive and restorative rather than punitive. You have probably seen our work as it relates to seeing gun violence as a public health crisis as it threatens the lives and well-beings on too many persons in our state and our nation. We also have focused our attention on what does it look like to have ethical and equitable policing that reverses the devastating legacy that has criminalized Black communities while not dealing with the root causes of crime. We also know of the importance of education, and we assert that providing equal access to high quality education that can be possible with adequate funding of public schools that will have well-qualified teachers, modern school buildings, effective leadership, and comprehensive curriculums. And finally, we focus on civic engagement. And we believe in having an informed electorate that has access to participate in the democratic process. And so with such an important election less than 100 days away, I want to invite you, wherever you are, to visit another organization that we've shared our work for, the website of the Conference of National Black Churches, thecnbc.net. And if you go there on the main page, you'll find a toolkit that will and can be used by faith leaders to organize your congregations to get the vote out. And so I've shared much about the work of ACT. We encourage you to follow us on social media at Black Clergy TN, at what was formerly known as Twitter, on X, at Black Clergy TN. And if you want more information or want to join up with the work that ACT is doing, email us at blackclergytn@gmail.com. That again is blackclergytn@gmail.com. But for what we've come for on this evening, This evening, we're pleased to welcome Monique Anthony and Evangeline Parker Guest to educate us and inform us about the non-medical factors that affect health outcomes. These conditions that we are born, grow, work, worship, live, and age with, these are the conditions that impact life expectancy. And so I just want to introduce both of them. They will come one after the other. Our first speaker will be Monique Anthony, who is a graduate of the Spelman College and East Tennessee State University. She serves as the Deputy Director of the Office of Minority Health at the Tennessee Department of Health. In her role, she provides support to the administrative, financial, and program operations to reduce health disparities, advance health equity, and improve overall health and well-being of minority populations, especially racial and ethnic minority populations across the state. Ms. Anthony also serves as a trusted and recognized subject matter expert in addressing health disparities and outreach to minority, rural, and vulnerable populations for various communities, work groups, and learning collaboratives. She serves as a co-chair of the Tennessee Health Disparities Advisory Group, member and support lead to the TDH, Tennessee Department of Health, Health Equity Advisory Team, and a member of the Vanderbilt Ingram Cancer Center Community Advisory Board. And so we're grateful to have Monique Anthony and then as well, Evangeline Parker Guest, who is a 25-year career veteran for Comcast and serves as the Senior Manager of External Affairs for the Comcast Big South region, overseeing government and community relations in Memphis, Tennessee, and Little Rock, Arkansas. She has been a leader in community investment projects with historical significance, including establishing Comcast Lift Zone partnerships with Alpha Omega Veteran Services, Girls Inc. of Memphis, and the YWCA of Greater Memphis, in order to provide robust Wi-Fi hotspots in a safe community space, allowing students, veterans, and families to get online, participate in distance learning, telehealth, and financial services. Evangeline leads the Comcast Internet Essentials Comprehensive Broadband Adoption Program that has connected over 500,000 low-income Memphians and Arkansans to the power of the internet. She believes connectivity opens the door to a world of opportunities. We're grateful to have Evangeline Parker Guest with us, but on tonight, I want you to welcome Monique Anthony as she leads us in our discussion.
Thank you. Greetings to all, and thank you, Reverend Turner, and thank you, Ms. Bonden, for the opportunity to share with you all this evening. I'll go ahead and go to the next slide. So as I begin my overview of social determinants of health, I would like to share with you a few commonly accepted definitions. These definitions are from the CDC as well as the Robert Wood Johnson Foundation. They include health disparities, which are preventable differences in the burden of health outcomes, including disease, injury, violence, and opportunities to achieve optimal health, experienced by populations that have disadvantaged by social and economic status, geographic location, and environment. Health disparities are typically largely caused by barriers set up at all levels of society. Health equity. Health equity is the state in which everyone has a fair and just opportunity to attain their highest level of health. And then social drivers of health, which is also commonly phrased as social determinants of health. We at the Department of Health have tend to label it as these factors as social drivers of health. So you may hear me use that term more often than social determinants. But these social drivers of health are non-medical factors that influence health outcomes. Compared to social determinants of health, in which these factors are considered to be determinative rather than modifiable, achievements require focused, ongoing societal efforts to address historical and contemporary injustices, overcome economic, social, and other obstacles of health and healthcare, and eliminate preventable health disparities. Thank you. So first, I would like to start off by talking about life expectancy here in Tennessee. Healthy life expectancy is an important measure of the overall health of a population. Unfortunately, Tennesseans experience a shorter life expectancy than the residents across the U.S. as a whole. Tennessee faces numerous health challenges with generally poorer health outcomes than most other states. We see high prevalence of chronic conditions, including obesity, diabetes, hypertension, which presents a major concern, as well as substance abuse, suicide, infant and maternal mortality. So as you can see, Tennessee is no short of many health disparities. Tennessee currently has a lower life expectancy than other states, as I stated, and so we're currently ranked at 45th in the nation. Next slide, please. I want to apologize because I realized that I labeled this particular slide incorrectly. This slide depicts the health outcome and health factor rankings in Tennessee. And so I wanted to illustrate here by showing you the comparison of those health factors and health outcomes, where it reveals that most counties fare as expected in health outcomes, given the level of health factors. And so you'll see in this map how numerous counties are mismatched. For many of the counties, the ranking health outcomes are worse than existing health factors, which you would suggest they would be. These are large in part relative to the urban and peri-urban counties in which availability of healthcare is high, but access and use may be constrained by time and cost factors. So as you can see, the top map shows our outcome rankings, the middle shows the factor rankings, and then that last map kind of shows a combined health outcome and factor rankings. So as I mentioned, the urban and peri-urban counties in which the availability of healthcare may be high, we also see that there are a number of counties in which health outcomes are better than the level of health factors available that indicate. Next slide, please. And so here's a depiction of how you can see how health outcomes vary widely across geography. However, indication and reporting of specific health disparities can be complicated by numerous factors in addition to geography. On a whole, Tennessee's urban county rankings rank higher in terms of health outcomes and health factors than the state's rural counties. There are a wide range of ranked levels by geographic types. Next slide, please. And so now I would like to transition into social determinants and health equity. As you can see, the conditions in which environments where we're born, where we live, work, play, worship, and age affect a wide range of health functions, as well as our quality of life and outcomes and risk. Social determinants of health are typically grouped into 5 key domains, which you see here. We have health care and quality, neighborhood and built environment, social and community context, economic stability, education, access, and quality. Tonight, I'll be sharing a little bit as it relates to those factors that encompass our economic stability as well as healthcare and quality. Next slide, please. So here you'll see where Tennessee has a high rate of adult poverty, ranking 38th in the nation, and the rates vary greatly both by sex and race ethnicity. And as you can see for the West region, Shelby County in particular, we're at a 15 to 19.9% in poverty rate. Next slide, please. Also, I would like to discuss nutrition insecurity as it relates to households with children. The state's percentage of nutrition insecure households is greater than the national level as well, with significant variation by race and ethnicity. Nutrition insecurity among adults is highest in rural counties, both overall as well as for race ethnicity groups for which there is data. However, the lack of data is a concern for when assessing demographics at the county level. Nutrition insecurity among households with children is highest in very rural counties, but also, as you can see here depicted by our map, within Shelby County. Next slide, please. Also, as it relates to environmental factors, we have air quality here. And this map depicts how exposure to environmental factors, including fine particulate matter or even heat-related stress, also can show how high levels of air pollution found in the metro and surrounding counties are affected. And as you can see for Shelby County here, we see the highest average density at a 9 to 9.8. Next slide, please. And so next I would like to talk about healthcare access and inequities in that. So for Tennessee, as I mentioned before, we tend to be at the bottom as it relates to health outcomes in our state. And so with Tennessee in the bottom tier of the states as it relates to healthcare access, we're currently ranking at about 40% for adults with health insurance. Likewise, with cost of care is a barrier for many Tennesseans, and the state ranks 41% as it relates to residents who avoided care in the past year due to cost. So variations in access to care is noted by age group and race and ethnicity, particularly for Hispanic Latino residents of the state. Additionally, primary care and dental care availability can be unevenly distributed, with resource shortage areas noted in both urban and rural areas, as you can see here. Also, I wanted to share access as it relates to hospitals. As you may know, there have been many hospital closures in Tennessee since 2010. This increasing number of vulnerable individuals within the population of Tennessee suggests that a key to improving health outcomes lies in developing awareness of those that are vulnerable and excluded, and considering active strategies to promote their health and social inclusion. Additionally, transportation support and linguistically and culturally appropriate outreach materials are critical components. And then lastly, I would like to highlight, as it relates to this map of closures, that Tennessee has been the second highest. Oh, and I'm sorry, please next slide. Tennessee has been the highest rural hospital closure rate in the nation, as well as highest per capita. Next slide, please. So just to give you an example of one of the activities or initiatives that comes out of our Division of Health Disparities Elimination is under one of our priorities, which we consider workforce development. And so for the last 3 years, the Office of Minority Health has administered funding to organizations to hire, train, and deploy community health workers to build resilience in combating COVID-19 through addressing health disparities in high-risk and vulnerable populations. So I wanted to share with you an example of a success story from one of our organizations that's based in Shelby County to kind of further show how these social determinants of health or social drivers of health impact our vulnerable populations. And so here I've outlined in this slide where our community-based organization sees patients. And in this particular encounter with this patient, they assess them for social determinants of health as well as their COVID-19 status. And so during this encounter, they discovered that this particular patient had over 10 social determinants of health. This included housing instability. It included food insecurities, transportation needs, utility needs. And so one of the things that our organization was able to provide was to be able to make sure that this patient had resources that were able to address each of those specific social determinants of health that they were dealing with. And that may have included referring that patient to the appropriate resources of other organizations in the particular area. And so in addition to referral to those particular resources that could address their transportation or food needs, they also provided gift cards or vouchers that would help that individual with transportation needs as well as utility needs. So we're very grateful to be able to administer these funds, in which we're partnering with community organizations, community health centers, faith-based organizations, and other organizations across other sectors to ensure that we are able to address social determinants of health. And that's through one of our investment streams, such as what I've described here through workforce development. Next slide, please. And so lastly, I wanted to talk about what could we do. And so the Division of Health Disparities Elimination partners closely with numerous divisions across our agency, but also external organizations, like I described earlier, in terms of community, faith-based organizations, and those entities that represent various sectors. Through the coordinated outreach and care efforts, our division has broadened our recognition of disparities in health outcomes experienced in diverse communities, and often driven by the common factors that we discussed as it relates to health outcomes and social determinants of health. So programs addressing areas of health inequity, such as access to care and ability to navigate care, has been critical in improving the health outcomes and in turn reducing disparities throughout Tennessee. So on this particular slide, I wanted to note just a few strategies in which the faith community can and has assisted in addressing social determinants of health. And that includes partnering with communities, partnering with the community and other faith partners to address social conditions that impact health, such as housing, food insecurity, and access to health services. Partnering with state and local government and other civic organizations to develop programs and monitor their impact. Also to become a source of linkage between community and health systems by providing referrals. And then also establishing health ministries that can include programming and interventions, providing evidence-based information to the congregations and surrounding communities. And then also developing health campaigns and using digital platforms or other communication channels. The picture that I've highlighted chose to highlight on this particular slide is a project that I serve as one of the project leadership team for this particular program. And this is a partnership with our agency, Tennessee State University, the Congregational Health Network in Nashville, as well as a few other community entities. And this particular project, I wanted to highlight this because it shows how through the various partnerships with academic institutions as well as community organizations, how we've been able to in some way touch the faith community and their congregants through these particular methods, which is being able to be a resource to them to provide suggested resources where they can implement programs and interventions with their congregations. Next slide, please. And so I wanted to share a resource with you within our agency that, I think back two slides. Okay. So here, as you continue to work on your efforts within ACCT, here's a couple of resources that we have developed within our agency over this past year. We have an annual legislative mandate report that we have just released for this particular year. It is housed on our website via the link on the slide. It is a health plan that highlights a broad array of health disparities and inequities and social determinants of health, as well as data from a range of program and sources. Additionally, our Division of Health Disparities Elimination just released a health disparities report that has been placed on our website as well, that includes some of the maps and data that I've showed you in this presentation that can also help to inform some of the decisions that you're making within your own interventions and programs. And I can place the link to our health disparities report in the chat as well. Next slide, please. And so the Department of Health aims for the state to move from the bottom rankings to becoming a national leader in ensuring equity healthcare access by achieving this vision. And so under that vision, the Division of Health Disparities Elimination also aims to expand the department's capacity to outreach, engage, and support minority, rural, and vulnerable populations through our mission, vision, and values, which you see on the screen here. And so in other words, where everyone has a seat at the table. And so next slide, please. I hope this information was valuable to you. We're dedicated to addressing health disparities and promoting equity in public health. And so we're committed to providing you with relevant information and valuable resources. If you would like to have additional information, we do have community outreach workers that are situated in every region of the state. So we do have an outreach worker that's based in Memphis, Tennessee, that works through our Office of Faith-Based and Community Engagement. So please feel free to reach out to me and I can connect you with them or the best appropriate person to give you the appropriate resources and support that you need for your efforts. So thank you for your time.
And thank you, Ms. Anthony. Ms. Anthony had shared with you an overview of the social determinants of health, but she also shared that, Tennessee is at the bottom in almost all of those areas. She shared some solutions of what you can do. And I ask you to stay on the call because we're going to share more solutions. We're going to welcome Ms. Parker Guest now to talk about Comcast Cable and how we can partner with them to address the social determinants of health and make our individual lives healthy, but also our communities healthy. And then after Ms. Parker Guest finishes, I will come back to you with a plan for how we can all partner. So please stay with us. Ms. Guest.
So thank you so much, Dr. Bondon, for inviting me to be here with you. I am Evangeline Parker Guest, Senior Manager of External Affairs for Comcast. And I want to thank Dr. Turner for that that enthusiastic introduction. I've never been introduced so well, so I'm excited at 7 o'clock in the evening to be with you to talk about Comcast Foundation grant guidelines. And because Dr. Bonden, when I met her at a faith-based dinner, and we talked about Comcast's commitment to the community, and Comcast pledged in 2020 to invest $1 billion. And yes, I said 1 billion with a B, in the communities where Comcast employees live, work, and serve. Dr. Bonden said, well, show me the money. Show me how to connect to the money. And so that's why I'm here. And if we can go to the next slide. We're going to talk about the focus areas for the Comcast Foundation, because there are key focus areas, and there are 3. And I'm going to do a high-level overview of this process, because a lot of times we have nonprofit organizations who want to submit a grant for funds, but the focus areas are not there. And so I want you to really key in on these focus areas, which, number 1, connectivity and adoption. Number 2, skills and creativity. And number 3, entrepreneurialism. So connectivity and adoption, I'm going to go into detail and just kind of give you the overview of what a grant should consist of for connectivity and adoption. So let's start there. Next slide. So for connectivity and adoption, that is basically a nonprofit 501c3 organization who wants to provide equipment access to their clients or to the community. For example, if you are a church and you have an after-school program and you want to expand that by creating a computer room, and you need funding to pay for the creation of that computer room, that would fit under connectivity and adoption. If you have someone who is going to be doing basic literacy training, that is how you turn on the computer, how you set up email, how you engage in email, how you navigate a virtual platform like Zoom and Teams and other virtual platforms, how you connect to Facebook and other social media platforms. Or if you want to train the trainer, we call that digital navigator, you want to go much more deeper into digital navigation, then there are grant funds for that. So the connectivity and the adoption, that is really the basic level of our grants. Let's keep moving forward. Next slide. Measurable outcome and examples. So for connectivity and adoption, maybe your grant would be that 200 households received information and support to access broadband, or 10 digital navigators were trained, or 50 participants received basic digital skills training using Microsoft Suite or cybersecurity, or learned how to connect to Wi-Fi or Wi-Fi hotspots. Less is more when it comes to Comcast Foundation grants. They want to know specific details of what the measurable outcomes will be and what you achieved after the grant is completed. Let's keep moving forward. So here's some project examples. Equipment access, Workforce Opportunity Center, and you want to provide technology for your clients there. A neighborhood action center, you want to connect youth and families or senior citizens to community-based digital literacy training. Digital navigation, once again, a community-based organization, assisting residents with internet adoption, the use of computer devices, how to secure your broadband service, and learning basic literacy skills. Basic information, once again, less is more when it comes to a Comcast Foundation grant. Let's keep going. Focus area number 2, skills and creativity. That's where you go a little bit deeper. First section, adoption and connectivity, that's basic level computer training. Focus area number 2, you're getting more advanced. You're getting more advanced into teaching Photoshop and about JavaScript and basic coding, and soft skills training can be involved in that. Just deeper computer skills where you have youth, you have an after school program, and you want your young people to learn about technology careers, or something they're calling it now STEM careers. You can teach that. And in the right-hand corner, you see a photo that says in school and after school programs at lift zones. This fall, we will be relaunching our Lift Zone program. In 2020, when COVID hit and we learned that schools were closing, there were families who did not have access to the internet and needed it. We partnered with community organizations, Girls Inc., Alpha Omega Veterans, and others we'll talk about a little bit more later, to provide them high-speed internet service that Comcast pays for. And so if that is something that you would be interested in, that you want to start an after-school program around delivering technology, a technology curriculum and access to technology, then that's what a Comcast grant can assist you with. Let's keep moving forward. Focus area number 3, entrepreneurialism. The slide that I have behind me says Comcast Rise. That is a separate program from this, but this is a good lead in for Comcast Rise. So I'm going to make my way from focus area number 3 to the Comcast Rise behind me. This grant here is for teaching those digital skills for entrepreneurs, where you can learn how to create the website development, user interface, digital marketing. It teaches the entrepreneurial skills for those who want to launch, grow, and sustain their business. Comcast Rise. Last year, Memphis was selected as a Comcast Rise city, one of 5 by headquarters. So that meant that headquarters pledged to give $1 million investment in the Memphis Shelby County community to small businesses, giving them Comcast Rise grants. And they did that. There were 100 small businesses that were selected and awarded. In addition to receiving the $5,000 grant, they also received the production of a commercial. They also received a technology makeover. They also received a television schedule to promote their business for 1 year. And so the Comcast Rise program is another way the company is investing in the community with grants. And that's a different process. We're hopeful, since we had such a great program in 2023, that we will have such a great presentation this year. We'll be selected for 2025. So let's keep going. Focus areas. Remind you, if you have a program that fits one of these focus areas, please connect with me so we can figure out how we can partner together and hopefully connect you with the Comcast Foundation. It is a nomination process, so our grant window is open from March through September, and the awards are in October. So in February, I reach out to nonprofit 501c3 organizations in my database, and I send out a spreadsheet. And on that spreadsheet, you give basic information, a basic overview of what your program is and how much funding you would like and what the funding would be used for. It's a basic overview. That information is then provided to the community impact team for review. And they are the first phase before it goes to the Comcast Foundation. If it is found that it fits within one of the focus areas, and it looks like that it would be a benefit to the local community, then you are invited to submit a Comcast Foundation grant. So let's keep moving forward. Partnerships matter to Comcast. In 2011, we rolled out the Internet Essentials program. That is the flyer on the left-hand side. It is affordable internet service for low-income families. Those families who are on a very strict budget, who could not afford regular internet service. Comcast offered internet service $9.95 a month. And it stayed that amount for as long as you wanted the service. And 13 years later, it is still $9.95 a month, 50 megabytes per second, good for up to 4 devices at one time to navigate and to do virtual learning, job search, whatever your needs are. And then when COVID hit, we realized that some families have the need for more devices. So Internet Essentials Plus was created. 100 megabytes per second, good for up to 5 devices at a time for $29.95. And more information can be learned at internetessentials.com about this program. There are also training guides there because there are lots of seniors that are on this program. But if you qualify for, or your constituents or members qualify for public assistance, SNAP, EBT, Medicaid, National School Lunch Program, odds are they are eligible for the Internet Essentials Program. And on the right side of the screen, you see photos of our lift zones. We partnered with Alpha Omega veterans during COVID. Those veterans needed to connect to their doctors and to counselors using telehealth. So we created 2 lift zones with Alpha Omega veterans, also lift zones with Girls Inc. of Memphis, YWCA of Greater Memphis, Crittenden County Boys and Girls Club, and I do cover Arkansas. So Central Arkansas Boys and Girls Clubs have lift zones. And in the fall, we will be relaunching this program. So if you are interested in being a lift zone location where you would have a room, technology room, have internet service there where your parishioners, or you want the community, they can come in and connect to the internet and connect to vital services that they need, then let me know. Would love to talk with you about establishing a lift zone. Next slide. For more information about anything that I've talked about, my email address is there. Please feel free to send me an email. Would love to become a digital equity partner with you. And internetessentials.com, you can learn more about internet services and the Comcast Rise program. If you have a lot of small business owners in your congregation, or you are a small business owner, I encourage you to go to Comcast Rise and learn more about that program. Looking forward to partnering with you. I am Evangeline Parker Guest. Thank you so much, and God bless.
Thank you, Evangeline. Thank you so much. So if you have questions, I want you to hold those to the end. Ms. Parker will stay on the call, and so don't get off. And I won't hold you much longer, but I'm gonna have you hold your questions to the end. Keep writing them down and putting them in the chat. So why do we have Comcast Cable on here? And we asked them to come because broadband can address several of the social determinants of health. Education, it can address, if you get your health care online, you need that. If you're doing farmers market, you need good broadband service. So we wanted to see the practical implication of partnering with Comcast to address many of the social determinants of health. So now I'm up. ACT created a toolkit. We're asking you to help us raise awareness about the social determinants of health and how they impact your individual health, but also your community health. Most people on this call, many of you may never have heard of the social determinants of health before today. We want everyone to know those terms and what they mean and how they affect their health and the community's health. And so we put together this toolkit, and for the next 6 months, we want you to walk with us and share this information with everyone. So what we're going to ask you to do is the campaign. We're going to have events in Chattanooga, Jackson, Nashville, Knoxville, and Memphis. These are in-person events that we will share more about the social determinants of health and share more about the partnerships that can help address those. We're going to provide you with social media graphics and posts that you can share online so you can educate, and then more information that you can share in congregations. That if you use a digital flyer for your congregation or using paper bulletins, we're going to provide that, and sermons, and just a host of things. And we're asking, when you post on social media, you use these hashtags so that we can keep that information so we know it's coming across. Black Health Matters, End Gun Violence, and ACT TN. So the first thing we're going to ask you to do is take a pledge. And why would you take a pledge? You take a pledge because if you say it, we do this in church. We recite things, and we do that for a reason. If you say it, you're more likely to be held accountable to doing it. So this is the pledge, and I'm asking Simeon. Simeon should be posting a link to the Black Health Matters pledge in the chat. This is the pledge on the screen, but if you click on that link, you can go ahead and sign your name and take that pledge. We want to hear your story. So when we're talking to policymakers, they need to know what's happening in the community. So we need to know your stories, what's happening as relates to your health care, as relates to your housing, to your education, if you're being discriminated against. So we want to collect those stories. And Simran is now posting a link in the chat where you can share your story with us. So then we talked about the events that we're going to be holding. And so if you're in Jackson or anywhere near Jackson, you want to drive, August 24th, we will be in Jackson with the NACP, the Jackson Madison NACP chapter there, sharing more information. In September, on the 21st, we'll be in Chattanooga. And then on the 28th, we will be with Memphis at the Mississippi Boulevard with the Innocence Project. We'll talk about how harmful the justice system has been to people who have been incarcerated or falsely convicted, and how the social determinants of health impact their lives when they are released. We will be in Knoxville on October 5th for a health fair, which really specifically addresses health of individuals and communities. And then in Nashville in October. And then on February 2nd, we're going to have a Social Justice Sunday. The purpose of the Social Justice Sunday is just to share the impact of the social determinants of health and what justice can do and what we ought to be doing as a church family or a faith group. And we're providing you the social media, possible sermons, biblical verses, everything that you will need. And then February 4th, we ask you to join us in Nashville to talk to our legislators about how the social determinants of health impact our lives and what they can do with policy and legislation to improve it. So as to social media, we've chosen focus areas. You're going to get, everyone who registered will receive a toolkit. I will email it to you tomorrow, and it will outline to you how to use the social media graphics. August through September, we're going to focus on back to school. What social determinants of health should we be addressing going back to school? We should be getting our children enrolled in medical insurance. If it's TennCare, they be taking physicals. There's just a host of things that we can do as we go back to school. And so we want to focus on that for August through September. And then we're also going to August to September back to school, what the faith community can be doing to address, to help young people as they return to school. October, we're going to address housing because that's low-income housing month. And so we'll have social media for you to share about affordable housing and what the impacts are. And then because we have an election in November, so starting now through November, we're providing you social media about voting information. Where do you go to vote? What poll sites? Any information that you would need about early voting or getting registered to vote, just a whole host of information about voting that we can share within our churches. And then August through January, as we lead up to the legislative session, we want to talk about Medicaid expansion, public education, and gun violence prevention. So those are the things that we're going to be asking you to do. We will be sharing that information with you by email. We hope that you'll stay tuned. Reverend Turner, if you'll now do the call to action.
Yes, so I'm sure there'll be some Q&A, but I want to just circle back. I'm remembering one of the great songs that carried our ancestors through the horrors of slavery in America. And the lyrics were a little bit like this: hold on, keep your eyes on the prize, hold on. And in this season where there's lots of energy and excitement about the person who will occupy the White House in 2025 and moving forward, and rightly so, I think it is as important for us to realize that many of the decisions that impact our daily lives are made at the state and the local levels. And so it is important that we, as we focus on turning out November 5th, that we also are organizing ourselves as clergy and community members in order to advance the things that are impacting people's everyday lives. And at the top of that list, we know that these social drivers of health are doing so. So I want to again challenge you, please. I want you to take the pledge, those of you who are on, but also encourage the persons in your community as well as in your congregations to take the pledge as well that reaffirms that Black health matters. But then as well, you've seen the listing of events. We hope that when those events are coming up in your area that you will share and invite others to participate as well, because that helps us to educate and inform persons about these issues that really matter the most. And so, brothers and sisters, keep your eyes on the prize, hold on, and we hope for major convening February the 4th, 2025 in Nashville, Tennessee, at the Cordell Hall office building, where we want to show not only does Black health matter, but Black faith matters as well. So please check out our website, blackclergycollaborative.org. Email us at blackclergytn@gmail.com. You see the phone number as well on the screen. And then you can follow us on Instagram, Facebook, as well as X at blackclergytn. So thank you so much. And Dr. Brown, I think we'll open up for questions now. There any questions for either of our speakers tonight? We want to thank them for being with us. Monique Anthony and Evangeline Parker Guest, thank you all for being with us. Are there any questions? Well, awesome. Thank you all for being on. Please be on the lookout for tomorrow's email of the toolkit. And then we hope that you would stay tuned to the action that's taking place through the organizing of ACT around this state. Have a good evening.
Okay, gentlemen, it's down to us. Earl, we could not figure out how to stream it online. We worked on it all, I mean, it's for hours today, trying to get it to work, and it could not get it to work, so.
I think I always feel this way, like, do we do it again? So that we could, because you got to get this information out. Need more people to become more informed and, build conscious across the state. And she basically told us, gave us,